Good afternoon. Thank you for joining us for today's Data Summit topic, Early Childhood, Census Bureau Data Sources. We're delighted to have you with us today in what is the next installment of the Census Bureau's 2021 Data Summit series. My name is Lindy Studs, and I am your host for today. Before I go into the agenda, I'd like to cover some basic information and house rules. This summit will be recorded for the benefit of attendees and other stakeholders who are unable to be present. For those who do not wish to be recorded, please take this time to opt out and drop from this session. Because of the number of participants on this webinar, everyone has been muted. We encourage everyone to utilize the chat box. We will not be able to answer all questions due to the volume of participants. Any general questions that are not answered, please contact ask.census.gov. For any other inquiries regarding apportionment or redistricting, please reach out to our Public Information Office by emailing pio@census.gov. For your convenience and future reference, please expect a PDF of today's presentation and a resource sheet in 2 business days. This webinar is being recorded and will be available at a later date. So, what is the objective of the Data Summit? Designed for the novice data user, the series will present a high-level overview of several data products and demonstrate how they can be used to assist organizations and businesses identify data-driven solutions to challenges. Learn about how your responses to Census Bureau surveys are used to create publicly available data products. At the conclusion of this session, you will have an increased awareness of the vast data products available through the U.S. Census Bureau. You'll be better equipped to utilize some of the free online tools available on census.gov, and you'll have resources and toolkits to assist with navigating data available through census.gov. We offer these summits to thank our many committed 2020 census partners by showing them that the value of partnership extends beyond the decennial count. Census Bureau data can help organizations make data-driven decisions. Today's summit is one example of how the Census Bureau also offers support to help you with accessing and understanding these data. Today, we will hear opening remarks from our wonderful census partner, Dr. Noreen Dollard from Florida Kids Count. Then, we will hear from our key presenter and subject matter expert, Kelly Karras. And we'll conclude today's summit with a Q&A session and a brief wrap-up. Before I turn it over to Dr. Dollard for opening remarks, I'd like to mention that the 2020 census apportionment data has already been released to the public. A link to the full release is in the presentation, which will be shared after this webinar. Any media-related inquiries, again, should be referred to pio@census.gov. As a friendly reminder, we'd like to inform you again that this webinar is being recorded and will be available at a later date. Also, expect a PDF of today's presentation and a resource sheet within 2 business days. After the census, shifts in population and congressional representation among the states require the redrawing of district boundaries within states. The Census Bureau provides states with the local area population counts that they need to redraw or redistrict their congressional and other legislative boundaries. The full redistricting data with toolkits for ease of use will be delivered by September 30th. The Census Bureau will notify the public prior to releasing the data. For more information on redistricting, including links to geographic support products such as maps, tables, and files, visit the Redistricting Press Kit at the link listed on this slide. Please note, the data will be released by August 16th. However, the full data with toolkits for ease of use will be made public by September 30th. A allow me to introduce our first speaker today, Noreen Dollard. Noreen Dollard is a research assistant professor in the Department of Child and Family Studies in the Luis de la Parte Florida Mental Health Institute in the College of Behavioral and Community Sciences at the University of South Florida. Dr. Dollard has more than 20 years of health services research and evaluation experience in the area of behavioral health needs of children and families across child serving systems. Currently, she is director of Florida Kids Count, sponsored by the Annie E. Casey Foundation, and leverages her experience with large administrative data sets to inform child and family policy with data. Because the census data that they rely on and the resources census data bring back to the state, Kids Count is focused on making sure that Florida's kids count. Introducing Dr. Noreen Dollard.
Hello, thank you so much for having me this afternoon. Okay, one second. There we go. Our work is funded by the Annie E. Casey Foundation and established in 1949. And our mission is to help America's children have brighter futures by strengthening families, building stronger communities, and ensuring equal access to opportunity. The Kids Count, the foundation in particular, is one of several of the Casey family foundations. We do this by providing reliable data analysis to in every state, in Washington, D.C., Puerto Rico, and the Virgin Islands. And what the Casey Foundation did about almost 30 years ago was and what they're best known for is a report card on child well-being in which the states are compared head to head. And very central to this report card are the census data. And why census data? Because I said initially that it's important that we have reliable and valid data so that we are a trusted source of information to decision makers in the area of child well-being. So we need data that covers multiple domains, which the census does. And we need data that covers multiple geographies. The Casey Foundation itself prepares these reports for the 50 states. And as grantees, we do similar work, but we may compare counties, or we may compare legislative districts or describe legislative districts. So we need data sets that are capable of doing this. Okay, sorry, I'm having trouble. Okay, let's try. So what do we do with these data, census data? We combine them with other federal data sources, nationally, of course, so that we can look across life domain areas for kids and families. And here's just a quick example of the Kids Count data book. So these are 4 areas and our rankings amongst the 50 states. So in economic well-being, education, which is our best showing, health, and family and community. And we are ranked here in Florida 35th out of the 50 states. And at the state level, we use these data, as I said, at the county level and also at smaller units of geography, such as counties, and even as small as legislative districts. And so we prepare products like we have a child well-being index as well. We also prepare legislative snapshots for all the Senate and House districts in the state of Florida so that consumers, so that voters, citizens are able to take this information and say to their representative or senator, hey, this is what things look like for kids in your community. What are you going to do about it? So it helps people who make decisions around kids make informed decisions. And this is the Florida version of the Child Wellbeing Index. And why am I here today? Because census data are central to our work. So I can't do my work without census data. So when the Census Bureau needs a hand, needs some support, that's what we do as a partner. And during the 1920 run up to the decennial census, we worked very closely with our census partners throughout the state and region, I suppose you would say too, because what we know from previous decennial census is that we tend to miss communities of color, and we tend to miss very young children, both of which we have large numbers of in our state. So we work very hard to raise awareness and mobilize our partners to make sure that we were getting the word out to communities so that all of our residents would be counted. And right now, if you guys keep up with what is going on in the Census Bureau, it was mentioned that the apportionment data are out shortly. You know, those are very important for redistricting, and these data will be used for the next 10 years. So it's super important for us to support our census partners as they do their work, and to also make sure the census keeps in mind our most vulnerable citizens, our little ones. So we keep up with what they're doing, and we try to support them in any way that we can. So thank you. I'll turn it back to you.
Thank you, Dr. Dollard. We thank you and all of our wonderful 2020 census partners for your unwavering dedication to ensuring a complete and accurate count. Now, allow me to introduce our key presenter and subject matter expert for today's summit, Kelly Karras. Kelly is a Census Bureau data dissemination specialist for North Carolina and South Carolina. Her current position involves educating the public on the availability, extraction, and usage of the vast array of data on the Census Bureau's website. Kelly has worked for the Census Bureau for 13 years. She received a Bachelor's of Arts and a Master's of Arts in Sociology from the University of North Carolina. Over the past 11 years, Kelly has provided hundreds of census presentations and workshops for a variety of groups, including nonprofit and professional organizations, local and tribal governments, educational institutions, chambers of commerce, and businesses organizations. Kelly, the floor is yours.
Good afternoon, everyone. Give me just a second. All right. So good afternoon, everyone. Thank you, Lindy, for being our host, and thank you, Dr. Dollard, for your remarks and for the commitment from your organization, Florida Kids Count, to assist in the completion of a successful 2020 census. I'm very excited to be here with you today to share the wealth of data available from the U.S. Census Bureau on the topic of children, including early childhood. And my hope is that today's session gets you thinking and makes you curious about how you can use the data in your own work. I have a ton of information to share with you, so I'm going to get started. An overview of today's session. We're going to discover the numerous sources of data available for children from the U.S. Census Bureau, and we're going to do this as we explore data in the following topic areas. We'll begin with a snapshot of U.S. children. We'll look at age trends, households, families, and living arrangements, poverty, disability, and the impact of COVID-19. You'll also learn about and gain access to useful resources on census.gov, as well as data tools and online demonstration, and highlighted throughout today's presentation. But first, I'm going to give you a quick overview of the U.S. Census Bureau. People don't often realize the breadth and depth of data collected by the Census Bureau. In fact, the Census Bureau is the federal government's largest statistical agency and has been coined the nation's data collector. Most people are familiar with the decennial census, the once-a-decade population and housing unit count of the United States, which is also the federal government's largest peacetime mobilization. But the Census Bureau also conducts two other censuses, the economic census, which is the official 5-year measure of America's businesses, and the census of government, which identifies the scope and nature of the nation's state and local government sector. In addition, the Census Bureau also conducts over 130 ongoing or annual surveys every year and supplies annual population estimates and less frequent population projections. The census count is mandated by the Constitution of the United States, Article 1, Section 2, which directs that a census or enumeration be taken. The Census Bureau completed the 2020 census last year. In the introduction, Lindy explained that the first 2020 data set, the apportionment data, was released on April 26th of this year. This release provided us with the national and state level populations as of April 1st, 2020. April 1st, 2020 is the reference date for all 2020 census data. The release also included the apportionment data, which is based on the state-level population count. The national population, which you see at the top of the slide, from the 2020 census was 334,449,281. From 2010 to 2020, the growth rate was 7.4%, the slowest growth rate we've seen in our country in close to 80 years. In terms of apportionment, which is how the 435 seats in Congress, specifically the House of Representatives, are divvied up among the states according to population. As you'll see in the map on the left, the 5 states in blue gained a seat in the House of Representatives. And this includes North Carolina, Florida, Colorado, Montana, and Oregon. Texas was the only state to gain 2 seats. Alternately, the states shown in orange lost a seat: California, Illinois, New York, Ohio, Pennsylvania, and West Virginia. And on the illustration on the right, we see data for Florida specifically, including the total number of representatives, which is at 28, that the state gained a seat from 2010 to 2020. It lists the total population from the 2020 census of over 21.5 million, and it had a 14.6% growth rate. Also, Florida ranks 10th in population density. And once you receive this presentation, you can click on the link at the bottom of the screen to see statistics for your own state. The next release is the redistricting data, which will be released in all formats by September 30th of this year. And the release schedule for other products has not yet been determined, so stay tuned for information on future releases. All right, so let's move on to the topic of the day, which is data for children. And I thought we'd begin with a snapshot of U.S. children. In the United States, there are currently 72,822,113 children under 18. And I thought I would pull out the population numbers for several groups. So there are over 7.5 million babies, 0 to 1, over 23.3 million children, 0 to 5, and over 35 million children, 0 to 8. And that 0 to 8 age group makes up almost 11% of the nation's total population. The 0 to 17 age group makes up over 22% of the nation's population. On the right side of the screen, you'll see the percent distribution by age categories, how the population under 18 is distributed by 3 age groups. And you'll see that the groups are fairly evenly distributed, with the 0 to 5 group making up 32% of the population under 18, 6 to 11 making up 33.4%, and finally 12 to 17 making up 34.6% of the population under 18. Please note that on each slide under the title, next to the bold dash, is the source or sources of data that's shown on this slide. So if you're interested in learning more, you can type the survey or the source into the search box on census.gov, and I'll show you where it's located during the online demonstration. This chart shows the race breakdown of the 18 and under population in the U.S., with 66.6% of children is white, 13.9% Black or African American, 1% American Indian and Alaska Native, 4.8% Asian, 0.2% Native Hawaiian and other Pacific Islander, 6.5% some other race, and 6.9% two or more races. And below the chart, you'll see that 25% of children are of Hispanic or Latino origin. In the white alone, not Hispanic or Latino origin percentage is 50.1%. Shortly, we'll discuss how our nation, especially the nation's children, are becoming more diverse. Age and sex data has not yet been released from the most recent census, but we can view population by sex and specific age group in this population pyramid from the Census Bureau's largest survey, the American Community Survey. And you'll see at the bottom right, this comes from the 2019 American Community Survey estimate. Each bar on the pyramid represents the proportion of that segment in relation to the overall population. Males are in the teal blue bars on the left, and females are shown in the orange bars on the right. Highlighted at the bottom is males under 5, which are 6.3% of the population, compared to females under 5, which make up 5.9% of the population. Males 5 to 9 make up 6.4%, and females 5 to 9 make up 6% of the population. So what does this mean? How has the younger population changed over time, and what does the future hold in terms of population change? Okay, that's what we're going to explore in the next section, age trends. Okay, so the graphic on the left shows how the population distribution by age went from a pyramid shape in 1960 and is moving toward becoming a pillar using 2060 population projections. Although declining fertility plays a role, the driving force behind America's aging is the baby boomers. As one of the largest generations in the country, boomers leave a substantial imprint on the population and will expand the number of older adults as they age. The graphic on the right shows that in coming decades, the percentage of children will slightly decrease from 22.8% in 2016 to 19.8% in 2060. While the percentage 65 and over will increase from 15% to 23.4%. All right, by 2060, the national population is projected to reach over 404 million with a growth rate of 25.2%. But how did the projections break down in terms of age groups? The under 18 population will number right over 80 million with a growth rate of 8.8%. The 18 to 44 years and the 45 to 64 years population will grow 14 and 15% respectively. The 65 and over group as a whole is expected to grow 92%, with the largest growth occurring in the oldest age groups, 198% for 85 years and over, and an astonishing 618% for the 100 years and over age group. Okay, for children, the biggest demographic shifts we've seen and will continue to see is in the move to an increasingly diverse population in terms of race and Hispanic origin. By 2060, the Census Bureau projects about 2 in 3 children will be a race other than non-Hispanic white. And there are 3 main groups that drive this change. The group of children who are 2 or more races is projected to more than double between 2016 and 2060. Over the same period, the share of Hispanic children, illustrated in the medium purple color on the bar chart, is projected to rise from 1/4 at 24.9% to nearly 1/3 at 31.9%, while the share of Asian children, shown in the green bars, will rise significantly as well, from 5.2% to 8.1%. And these changes mirror a broader transition in the United States to a more diverse nation. What sets the younger cohorts apart is that their racial and ethnic makeup has been changing more quickly than for older cohorts. Even in a relatively short time period, here from 2010 to 2017, we can see some noticeable changes in the distribution of race and Hispanic origin. And the most noticeable change here is the increasing population of the Hispanic origin, increasing population of those of Hispanic origin, shown in the darkest blue portion of the bar. We also see increases in the Asian population in yellow, and the population of 2 or more races in green. And my colleague Victoria is sharing some links with you, relevant links as we go through the presentation today. And before the end of the session, before you log off, I urge you to grab those links, just copy them and paste them into a document to serve as resources later. Okay, another way to look at trends, specifically the changing age composition of the population, is through dependency ratios. Dependency ratios indicate the dependent population's potential burden on the working age population. In other words, how many people do the working age support? On the left, in the first column, is the youth dependency ratio. This is in the purple bars, shown from 1940 to 2060. If we look at 2010 and 2060, we see that the youth dependency ratio will decrease slightly from 38 in 2010 to 35 in 2060, meaning that there will be 35 children under 18 for every 100 working age adults between age 18 and 64, which is the lowest youth dependency ratio we see on record here. You can look at the previous years and you'll see much higher numbers. In the middle is the old age dependency ratio, shown in the green bars. The old age dependency ratio is projected to nearly double, rising from 21 in 2010 to 41 in 2016. In other words, there will be 41 people aged 65 and over for every 100 working age adults between 18 and 64. On the right is the total dependency ratios, and you can see a shift from a purple dominant bar in 1940 to a green dominant bar in 2060. Basically, the United States is expected to shift from a youth-dependent population toward an old age-dependent population, as older adults outnumber children. What's also evident is that the total dependency ratio is quickly increasing from 59 in 2010 to 76 in 2020, meaning that the youth of today will have a larger caregiving burden as working adults. And I've included a link to the source of this chart, which is a report, and whenever relevant, I've included direct links to tables or reports for additional information. And again, you'll have access to the presentation within 2 business days rather. What's causing the decrease in the under 18 population? One of the demographic trends driving a lower fertility is the increasing trend to delay marriage, which can be seen even in this short 10-year period from 2006 to 2016. Believe it or not, in this 10-year time period, the median age at first marriage has risen approximately 2 full years to 30 for men and 28 for women. For reference, in the 1960s, the average age at first marriage was 23 for men and 20 for women. So that's a 7-year increase for men and an 8-year increase for women. But again, in the last 10 years, there's been a full 2 years difference. So we're seeing big jumps when we look here at this chart for women and men in each age category. So in 2006, 46.6% of women were never married. In 2016, that number jumps to almost 60%, a change of over 14%. In the 30 to 34 age group, the never married group increased from 26% to 36% never married. And what this is showing us in a very short period of time is that people are waiting to marry. All right, so now we're going to cover household compositions. We're going to look at the most common living situations for children and see how these living arrangements have changed over time. According to the 2019 American Community Estimates, there were 120.8 million households in the United States, and the average household size was 2.62 people. And the bar chart shows that married couple households made up 48.2% of the households, while cohabitating couple households made up 6.3%. The next two categories include people living alone and those with children, which is why the numbers are slightly larger than what you're going to see in later slides. Female household or families with no spouse or partner present and own children under 18 made up 27.7% of all households, while the male householder households with no spouse or partner present were at 17.8%. All right, now let's move on to the living arrangements of children and how they've changed over time. I find this graph fascinating, first off, because it illustrates 52 years of data, ranging from 1968 to 2020. And the data here comes from the Census Bureau's current population survey. And what this shows most notably is that the number of children living with two parents has dropped from 85% in 1968 to 70% in 2020, while the percentage living with their mother has almost doubled from 10.7% in 1968 to 21% in 2020. This chart shows the age distribution of children by living arrangement. The age profile of children residing in specific living arrangements varies. For example, the share of children 0 to 5, 6 to 11, and 12 to 17 living with two married parents did not differ significantly in 2020. However, more than half of children living with two unmarried parents were between the ages of 0 and 5. Children living with one parent or no parent were older, more often ages 12 to 17 than 0 to 5 years. And as a side note, those not living with a parent often lived with a grandparent or another relative. This chart shows the differences in living arrangements among race and origin groups. Living with two married parents was the most common living arrangement for children of all race and origin groups other than Black children. Fewer than 2/5 of Black children were living with two married parents in 2020. These children were most likely to live with their mothers only, with nearly half living in this arrangement in 2020. Asian children were the most likely to live with two parents, followed by the white, non-Hispanic children and Hispanic children. And much of the living arrangement data that we just viewed came from the Census Bureau's current population survey, which is a survey that is jointly sponsored by the U.S. Bureau of Labor Statistics and the U.S. Census Bureau. This survey asks questions about work, earnings, education, and living arrangements, as we just saw. The scope of the survey is large, and one of its benefits is its historical data, so we can identify and view trends not only in employment and income, but in households over many decades. The survey also collects additional information. The supplemental questions that are asked every month vary, but they cover a wide variety of topics as well, including child support, volunteerism, health insurance coverage, and school enrollment. And also, just as an interesting side note, I bet you did not know that the current population survey is the data source for the monthly unemployment rate released by the Bureau of Labor Statistics. And that's the first of several survey spotlights I wanted to provide, just to give you a little more information about where the data are coming from. Okay, the next topic is children living in poverty. This line chart shows the poverty rates from 1959 to 2019. And in 2019, the poverty rate for people under the age of 18 decreased to 14.4%. And this is down from 16.2% in 2018. And this means approximately 10.5 million individuals under the age of 18 were in poverty in 2019. And this 14.4% poverty rate, it reflects the lowest child poverty rate observed since 1973. We also see decreases in the poverty rates for people 18 to 64, which decreased to 9.4%, down 1.2 points from 10.7% in 2018. And finally, for people aged 65 and over, the poverty rate was 8.9%, a decrease of 0.9% from 2018. This map shows poverty status by state for the under 5 age group specifically. This data comes from the Small Area Income and Poverty Estimates, the only source for single-year poverty estimates for counties of all sizes. The map comes from the Small Area Income and Poverty Estimates tool, an easy-to-use interface where you can create maps for different age groups on several different income and poverty categories. The highest poverty rate for the under 5 population was in Mississippi, which the poverty rate for the under 5 population was 30.2%. The second highest was Louisiana at 28%, and the third highest, New Mexico, at 25.2%. Arkansas, Alabama, and Kentucky also fall into the highest category, which is represented by the darkest green. And New Hampshire had the lowest poverty rate for under 5 at 8.7%. Okay, this map shows poverty rates for the school-age population in the 5 to 17 age group, this time by county. And being able to drill down by county and local level data is one of the advantages of using data from the U.S. Census Bureau, and Dr. Dollard mentioned the importance of that. And it is important to note that the geographic availability of census data depends on the specific data source. And working with one of our data specialists, like myself, is a really great resource for helping you determine which data source is best for your project or resource. So we are available to assist you with that. And this figure shows the poverty rate, again, by county for school-age children in families. And in 2019, which is the year this data comes from, 27.2% of counties had a poverty rate statistically greater than the national poverty rate of 15.8% for children, while 21.4% of counties had a poverty rate statistically lower than the national poverty rate. It's important to note in Mississippi and Louisiana, 70% or more of counties had a school-age child poverty rate statistically higher than the national average, 70%. In 5 states, 70% or more counties had a school-age poverty rate statistically lower than the national average. And those include Connecticut, Hawaii, Massachusetts, New Hampshire, and Rhode Island. And to give you a little more information about how the data is used, the Small Area Income and Poverty Estimates, these statistics are used to allocate funding under Title I of the Elementary and Secondary Education Act. And Title I funds are distributed to school districts based on the number and percentage of low-income children. The U.S. Department of Education plans to use the 2019 estimates to calculate the fiscal year 2021 allocations for Title I and several other federal education programs to provide funding to states and school districts in the 2021-2022 school year. And more information can be found in the link below the map. Here's a breakdown for median income, public assistance, and poverty by 3 family types, all including children: married couple family household, male householder, no spouse present, and female householder, no spouse present. This data comes from the 2019 American Community Survey estimates. Median income differs across the 3 groups. Married couple families have a median income of right under $104,000. Male householders with no spouse are right over $48,000, and female householders with no spouse are just over $31,000 a year. In terms of public assistance, 13.1% of married couple families, 27.1% of male householders, and 46.2% of female householders receive public assistance. Lastly, viewing poverty rates by family type, we see that the highest poverty rates are in the female householder families at close to 40%, while the male householders are at 19.4%, they're still over the national rate of 10.5%, and the lowest poverty rate was seen in the married couple family household at 7.6%. And I know this is a lot of information that I'm providing to you, a lot of statistics, and I'm hoping that this gives you an idea of all of the extremely useful data that we have available to you, and it's all free of charge on the Census Bureau's website. Some families experience long-term poverty, and others might find themselves temporarily living below the poverty threshold due to changes in employment or family situations. This table is from the Survey of Income and Program Participation, and it tells us that of the 24.1 million children ages 6 to 11 in 2018, 3.8 million, or 16%, were in poverty for the entirety of the previous year. And an additional 2.7 million, or 11.4%, were in poverty for some months, but not all of the previous year. And for those that were in poverty some months, the table shows us that 6.1% were in poverty 1 to 5 months, and 5.2% were in poverty 6 to 11 months. The data that we just viewed comes from the Survey of Income and Program Participation. And this survey follows families over time, and it really helps to provide us with data that has a wider lens and more detailed information on how children and families live over time, instead of a general point-in-time estimate or a single period estimate. So we can see change over time. It also allows us to gain a better understanding of topics including income, labor force participation, social program participation, and eligibility, and general demographic characteristics to measure the effectiveness of existing federal, state, and local programs. Okay, the next topic that we're going to look at is disability status of children. When we think of disability, we often think of the older population, but data from the American Community Survey shows us that on average, 4.3% of the child population experiences a disability. And this is up from 3.9% in 2008. So currently, 3 million children experienced at least one disability in 2019. The pie chart in the middle illustrates that the percent with a disability are in light blue, and those without a disability are in dark blue. And of that 4.3% with a disability, almost 3/4 are living with one type of disability, while 27%, 1/4, experience more than one type of disability. And we're going to look at that in a minute, the different types that they experience. The bullets on the left provide more information about how disability is measured and the types of disability data collected by the American Community Survey. The Census Glossary is linked at the bottom of this slide, and it's an excellent resource for accessing the census definition for terms such as disability. And there are links within the definition that take you to more information on that topic. And I'll also provide you with a link to the disability topic page and all of the other topic pages relevant to what we cover today at the end of the presentation. How does childhood disability differ by race? The rates of childhood disability are the highest among the American Indian and Alaska Native at 5.9% in 2019. The next highest rates belong to children of more than one race, 5.2%, and Black children at 5.1%. Non-Hispanic white children fall at 4.3% at that national average. Asian children at 2.3%, Native Hawaiian and other Pacific Islander at 3.2%, and the disability rate for the Hispanic population under 18 is the same as the non-Hispanic white at 4.3%. And this comes from a report which is linked at the bottom, U.S. childhood disability rate up from 2019, and this is from the American Community Survey again. Here we see the prevalence of different disability by age and type. And the chart shows us that the hearing difficulty is relatively stable over all age groups at 0.5% to 0.6% of the population within these groups. Seeing difficulty is higher in the 5 to 14 group at 0.8% and the 5 to 17 group at 1.1%. And note that the under 5 age group is not asked all the questions as they're too young to classify for all but the hearing and seeing disability types. Where we see the highest percentages of disability is in the cognitive difficulty. And it is the same across both of the groups. And it is roughly 4.4% of children age 5 to 17 and age 5 to 14 had serious difficulty concentrating, remembering, or making decisions. Ambulatory difficulty, which includes walking and climbing stairs, is slightly higher in the 15 to 17 age group at 0.7% than in the 5 to 14 group at 0.6%. Self-care difficulty is higher in the 5 to 14 age group, where 1.1% of children have difficulty dressing or bathing. Independent living difficulty, which include doing errands alone, questions asked only of those 15 and over, is at 2.4% of the population in that age group. Okay. Childhood disability was more prevalent in certain states in 2019 than in others. Comparing disability rates by state, Vermont had one of the highest childhood disability rates in 2019 at 7.2%. Other states with a high prevalence of childhood disability in 2019 included Maine, Louisiana, Kentucky, and West Virginia. Compared to the national average, childhood disability rates were relatively low in South Dakota, North Dakota, California, Utah, and Hawaii. Having a disability often involves some kind of medical care to treat the condition. And this map shows the uninsured population under 19 by county. This data comes from the Small Area Health Insurance Estimates. And the map comes from the tool, the Small Area Health Insurance Estimates tool. And here we see large percentages of uninsured in Texas and Wyoming. And the highest uninsured rate was in LaGrange County, Indiana, at 30.1%. Lastly, in disability, and this links together with the previous topic of poverty, in 2019, children living in poverty were more likely to have a disability than children living above the poverty threshold. The difference in the prevalence of disability between children below and above the poverty threshold is noteworthy, and families in poverty tend to have fewer financial resources to care for a child with a disability. Okay, now it's time to look at the American Community Survey and the Survey Spotlight. And we've seen quite a bit of data from the American Community Survey throughout the presentation today. The data source, this particular data source is key for providing information at not only the national level, but all the way down to the local level. It's a survey of over 3.5 million households annually, and it replaced the long form of the decennial census. And it asks questions about income, computer use, internet access, education, and more. So it really provides that rich, detailed, characteristic data that we don't ask about on a decennial census. The American Community Survey releases annual data and updates for areas large and small. And some examples of the topics are listed at the bottom of the slide and fall into 4 main categories: demographic, social, economic, and housing. And for more information on the American Community Survey, you can go to the American Community Survey or ACS website at the bottom of the slide. And it's important for everyone on the webinar today to be aware of all of these current surveys that the Census Bureau conducts, because it's very possible that your address may fall into sample at some point, and the data that we collect from your household and every household are extremely important and represent responses from thousands of other households as well. Okay, my last topic is the impact of COVID-19, the pandemic, on families and children. How did the COVID-19 pandemic affect households and children in the U.S.? Well, we can pontificate about it, but the Census Bureau provided almost and continues to provide almost real-time data on the impact of COVID-19 on American families. And I included some key headlines and statistics here. But basically, what we see over and over again is that households with children continue to be hit harder by the financial pressures caused by the COVID-19 pandemic. All right, so that data, all of the data from COVID-19 comes from the Household Pulse Survey. And the Household Pulse Survey provides a detailed and, again, near real-time picture of how individuals and households are faring during the pandemic. It was designed with input from other federal agencies, including the National Center for Education Statistics and the Department of Education. And it's a 20-minute online survey that can be completed only online. And what it does is it really tells us how the pandemic is impacting households across the country from a social and economic perspective. So the survey asks questions about child care, education, employment, food security, health, housing, social security benefits, household spending, and consumer spending associated with stimulus payments, intention to receive a vaccination, and how transportation has been affected by the ongoing crisis. So it's really a fascinating survey, and we're going to look at some of the data that's come from the survey. And the first round of data that was collected was for the April 23rd through May 5th period. Okay, the first map that I want to show you, I'm highlighting several data points from the Household Pulse Survey. Here we see data collected from respondents in survey week 12. Every week there is a new group of respondents, and this specifically shows the loss of employment since March 13th, which was the beginning of the pandemic. And it shows that Nevada had the highest rate of loss in employment, with an astonishing 65.5% of adults having had a loss in income. California and New York ranked second and third, and both had high rates of loss of employment, income at 58.6% and 58.1% of adults, respectively. while the national average was 51%. And some of the lowest rates of employment loss occurred in DC, Nebraska, North Dakota. Okay, this next map shows food scarcity by selected metros. And this is for week 21, December 9th through December 21st of 2020. And food scarcity is defined by the percentage of adults in households where there was either sometimes or not enough food, or often not enough food to eat in the last 7 days. And the map shows food scarcity for the top 15 metros represented by that time period. And what is really cool is that within this tool, it's very easy to use, but we can look at both state and metro level data. And the highest percentage of food scarcity in a metro area during this week was Riverside, San Bernardino, California at 18.7%. And right behind it was Detroit at 17.5%, and Miami, Fort Lauderdale at 16%, while the national average was 13.7%. This next map shows child care disruptions during week 28, which is the last week of late April 2021, and it shows the percentage of adults in households where children were unable to attend daycare or another child care arrangement because of the pandemic in the last 4 weeks. And the highest rate was in the Newark metro area, 16.5%. Next was Los Angeles at 14.6%, and Riverside, San Bernardino, also at 14% of households with children unable to attend daycare or another arrangement. And the national average at this time was 11%. Houston, Atlanta, Miami, and Dallas were all on the lower end in terms of disruptions in child care at this point. Okay, this map displays food assistance in the week following week 29, which was April 28th to May 10th. And it shows the percentage of adults in households with children enrolled in public or private school where students received food assistance from school in the last 7 days. The Phoenix metro area ranked highest in food assistance at right under 39%. Next was Riverside, San Bernardino at 37.5%, and then Detroit at 33.6%. The national average at this time was 26.5%. And the metros with the lowest percentages of food assistance from school were Miami, Washington, D.C., and the Newark metro area. Our last map shows data collected again from survey week 29, and it shows the percentage of adults living in households where children had an appointment with a doctor, nurse, or health professional by video or phone in the last 4 weeks. Rhode Island had the highest rates of children's telehealth visits for the survey period at 33.4%. Maryland was right behind at 33%, and Connecticut at 31%, and the national average was 23.9%. The states with the lowest percentages of adults in households with children who used telehealth in the last 4 weeks were North Dakota, Wyoming, and Nevada. Okay, this is the last data slide. We all know that the COVID-19 pandemic dramatically shifted the way children were being educated. So perhaps the most salient change was the closure of schools, forcing children to continue education from home. Nearly 93% of people in households with school-aged children reported their children engaged in some form of distance learning from home, but lower-income households were less likely to rely on online resources. And this comes from the Household Pulse Survey, Week 5. It shows that high-income households with children were using online resources at higher rates than those in lower-income households. For example, households with incomes of $100,000 or more, 85.8% of children reported using online resources for distance learning. By contrast, only 65.8% of people in households with income of less than $50,000 and 76.5% of households with incomes of $50,000 to $99,000 reported that children were using online resources. So we see some different percentages here by income category. Conversely, low-income households reported higher rates of using paper materials sent home from school than high-income households did. And the results were similar to previous weeks of household survey data. Okay, so I've given you a bunch of information, and it's time that I make sure that I provide you with some resources for you as you go forward in your census data journey. Okay, the first thing I'm going to show you are the topic pages. I think these are incredibly useful, and the Census Bureau in the last, I don't know, maybe 3 or 4 years has done a much better job of sort of cataloging the census data topics into these nice, neat topics pages. And the first one is families and living arrangements. And you'll see information, some data that I covered earlier, but it also provides information on child care, child support, grandparents and grandchildren, marriage and divorce, information on fertility. Okay, the next topic page is poverty. And I've included some additional links on this slide as well. So information on poverty thresholds, if you have questions about that. Also a link to which data source to use when it comes to income and poverty data, because we collect that information on several of our surveys, and it's good to know when to use which official source of the data. And again, a local data dissemination specialist like myself can help you sort of sort through this information as well. Here's the disability topics page, and I've included a link to the report that I referenced in several of my slides. And the COVID-19 Data Hub resource slide provides data and maps on how COVID-19 impacted not only households, but businesses as well. There's a business pulse survey to conduct that the Census Bureau has conducted to see how the pandemic has impacted small businesses. And here are a few more links to get your hands on data directly, either from the link in the middle, which is a table from data.census.gov, and I'm going to show you how to get there momentarily in the online demonstration. And on the right side of the screen, you'll see a map. That's from Census Bureau's Quick Facts. I'll also show you where that's located on the Census Bureau's website. And on the left is some additional resources, including data and stories on the topic of children. Okay, to recap, what we've done so far this afternoon is explore the census data sources on children through highlighting data through these main topic areas. We spotlighted children, explored some age trends, looked at family and living arrangements, poverty, disability status, and the impact of COVID-19. Some of the resources that we looked at were the topic areas or topic pages, data tables and links, maps, reports, and data dissemination staff as a resource as well. And Lindy provided the contact information for the Ask Data line, which comes directly to us in the data dissemination program. And you'll also see it again as well at the end of my presentation. So feel free to reach out, and we are here to assist you. Okay, so we're going to move on to the online demonstration. Give me just a moment. Okay, so I just wanted to take a few minutes to show you the Census Bureau's website and how to access some of the data that I've shared with you during today's presentation. So here's the main page of census.gov. And I mentioned the search box a couple of times, and it is a great place to look for information or data, say from a particular data source, such as a survey. You can type in one of the surveys that you saw in the presentation. It's also really useful when looking for those topic pages, such as the ones I referenced. One that I did not include in the resources is the general topic page on children, because there was a lot of overlap in the information on the children page and some of the other pages I provided. So let's go ahead and look at that now. I'm going to click in the search box, conveniently located up top. I'm going to type in children. I'm not going to take any suggestions. I'm just typing in children and clicking go. And we have quite a few search results here. I'm going to click on the first one. And this will bring you to the Census Bureau's subject page on children. So again, you're going to see some of those same links: child care, child support. You'll also see children's health insurance. Also on the page is news releases relevant to children, as well as publications. And you can view all news or all publications by just clicking here. I'm going to go back to the main page of census.gov by clicking on the logo. And once I'm on the main page, another way to view some of the topics that are available is just to hover over Browse by Topic. And you'll see a selection of topics here. I also wanted to point out this A to Z, the subject A to Z, is an excellent index, and it helps you find information on almost any topic related to census data. So if you have a question, does census have data on this or on that, go to A to Z, and you can click on the letter and see whether or not we have data on it. Okay, moving quickly here. The first tool that I want to show you, because I want you to be aware of where it is within census.gov and a little bit of the information that it has, is Quick Facts. Okay, so we're just going to click here on Access Local Data. And Quick Facts is an excellent tool for accessing frequently requested statistics. The data is compiled from a variety of census sources all in one place. And it provides data at multiple geographic levels, including national, state, and county, as well as for cities and towns with a population of at least 5,000. Let's say we're interested in finding data for Jacksonville, Florida. I'm simply going to type in Jacksonville. Okay, here it is. I'm going to click on Jacksonville City, Florida. Make sure you get the geographic area that you're looking for. Okay, and now we have it listed as a data column in our data table. So what kind of information does Quick Facts provide? Well, it provides the most recent population data. Here, it's the 2019 population estimates. And we see Jacksonville has a population of 911,507. And data for the United States, for the nation as a whole, is provided as a default. I think it's nice to have a quick comparison point for any of the statistics, but if you're not interested in data for the United States, you can simply remove it. The percent change in population, 10.9% from 2010 to 2019. And one of the data points that I wanted to draw your attention to is this: the persons under 5%. I thought this would be particularly interesting, that and the persons under 18%. And if we click on a statistic, it'll jump to the top of our table up here and really become our selected statistic. And if we say wanted to map the data, we can click on map. And it'll show us the data for Jacksonville, but it'll also show us the same information for cities in the area, in the viewing area here. And so we can simply click on them and see what their population percentage for the under 5 population is. Okay, Oakley Plantation, this is a census designated place in Florida. Jacksonville Beach, 4.8%. Fernandina Beach, 3.4%. And the legend is down here at the bottom of the map. And if we were interested in learning more about any of these places, we could just add them into our quick facts table. And we could discover more information about them. If I go back now and click on table, we should see both of those places. We do Fernandina Beach City, Florida, as well as Jacksonville, Florida. Another way to look at the data is by chart. Click on chart. And they're saying, do you want data for Fernandina Beach or for Jacksonville? I'm going to say Jacksonville. And you get this nice bar chart of all of the places within Florida and their percent under 5. Lastly, you can look at it in dashboard format, which gives you all three. You get the table, you get the map, and you get the bar chart. Okay, and in order to share it or download it, just click on More. Okay, lastly, I want to show you data.census.gov. Really the best way to go to it is just to type it in, data.census.gov, which is the Census Bureau's online, the largest online data tool, a resource that has many, many tables from many census data sources. And we could spend many hours on a data.census.gov training. But for today, I just wanted to show you what I think might be the most relevant table that comes to mind when looking at data for children. We see this streamlined look and feel, and right here in the center of the page, we've got a search box. So I say use it, keep it simple, let's use a search box. And if we're interested in finding data on children, simply type in children, click go, and we'll see a list of tables that have data on children. And the table that I want to show you is the Children Characteristics table from the American Community Survey. It provides a lot of information on children, and you've learned some about the American Community Survey today, but it provides it all in one place with some interesting cross-tabulations on children and the different types of households that they live in. I'm going to click on Children Characteristics, and in order to see more of the table and to get it out of this preview mode, and click on Customize Table. And you get data for the total population, under 18 in households, and then you get it by, you get a breakdown by the different types of households that children live in, such as married couple households, and male householder, no spouse, family household, and then female householder, no spouse, present household. And one thing I wanted to point out, because when I was looking at this table, I thought, oh, well, we spent a lot of time on this earlier in the presentation. I'm going to scroll down, disability status. Okay, and if you were paying attention, which I'm sure you were, there is the disability rate here of 4.3%, the national rate. But how does it break down by family type? And we didn't see that. We didn't look at that before. I thought it would be interesting to check it out. So we've got 4.3% total. But if we want to look at the married couple, family household, it's here, and we see that it's disability percent of 3.5. In male householder, no spouse present, slightly higher of 4.5. And in the female householder, no spouse present, it's much higher at 6.3%. This table also provides information on school enrollment, median income, public assistance, and all of the topics that are in the caps are good topics to take note of because they're easily searchable within census.gov. And this is just like a little snippet of the school enrollment data. It provides the number of children 3 to 17 enrolled in school by public or private, but you can also get it broken down by the grade that they're enrolled in. And this is, again, just an example of some of the data that's available on data.census.gov. And that concludes the brief online demonstration. And now we are going to move into the question and answer portion of today's session.
Thanks, Kelly, for that presentation. Wow, I continue to be amazed at the wealth of data that the Census Bureau has available. So at this time, as Kelly said, we're going to take a look at some of the audience questions in the chat box. Kelly, we have several, so we'll try to do as many of these as possible to get through them as quickly as possible. So the first question, Kelly, was you mentioned a glossary during your presentation. Can you remind folks where they can find that glossary?
Sure. And I'm no longer sort of manning the presentation, but that's fine. What I can do is just give you the web address. It's simply census.gov/glossary.
Okay, perfect.
Mm-hmm.
Okay, next question is, does the online query on data.census.gov include population projections, current population survey, et cetera, or is it just the census and ACS data?
That's a good question. It does not include the first two. It does not include the national population projections. You just have to specifically, you could type in national population projections into the search box and it will take you to their page. They have their own page with the projections and the data tables. It does not include current population survey data. It includes American Community Survey, as the person mentioned. It includes census data, 2010 and 2000 census data. It includes the economic census and many economic surveys, as well as other data. And trying to think of the best way to let people know, there's even more data included within data.census.gov. Most of the data within the search tool are data sets that include local level data. And if that's something you're interested in, I urge you to reach out to our Ask Data line and or myself, but probably the Ask Data line is best, and they can funnel you to your local data specialist who can help you get to the local level information and also share with you all the information that's available on data.census.gov. Thank you. That said, when you said current population survey, I do have to mention that on data.census.gov, if you scroll all the way down, you'll see a link to the microdata, the new microdata access tool, which does allow users to create custom tabulations, but only for specific geographies like states and public use microdata areas. So in that way, current population survey data are available in that microdata tool, as well as data from the American Community Survey. So that's just something to be aware of. If you go to data.census.gov, you can scroll down to the bottom, and I think it says Access Microdata, and you can click in there and kind of play around with creating your own tabulations. Okay.
Okay, great. So the next question is, what is the smallest geographic area that HPS can provide data on?
What is H? Okay. I'm not sure what the person who's asking the question is referring to on HPS, but what I can tell you, oh, ACS perhaps. Okay, the smallest geographic area that ACS provides data for is the block group level, and I meant to mention that, so great question. And that is the second smallest census geography, only after a census block. So American Community Survey has data down to the block group level, and the only geographic area smaller than that is a census block, and census block data comes from a decennial census. So you'll be getting block level data from the 2020 census.
Okay, and next question is the poverty data segmented by zip code?
Yes, it is. You can access poverty data by zip code through the American Community Survey. So yes, you can break it down by that and create maps using zip code level data on poverty as well.
Okay, great. And next question is, in the American Community Survey, can you select more specific ages, for example, under 3 years old?
You know, I don't think they have under 3. They're pretty specific. Those age groups that you saw earlier in my presentation, like 0 to 5, 6 to 11, 12 to 17, they like those age groups. Those must be age groups that are used by federal agencies for different purposes. But that goes back to that, the microdata access tool where you're able to create your own categories. In addition to creating your own cross tabulations, you can create your own categories, but you can't do it by zip code. You would only be able to do it by state or public use microdata area. So you're limited geographically speaking, but if it's national data that someone is after, or again, the public use microdata area, then that tool would be able to answer, that kind of query.
Okay, and one last question, hopefully we can quickly get it in. So when you were discussing the COVID-19 and the household pulse survey, one of our attendees commented in the chat that they just got asked via text message yesterday to be a participant in the pulse survey, which they were thrilled about. But their question is, what is the outreach strategy for the household pulse survey?
That's a good question. So first of all, I too was selected for the household pulse survey very early on, and I got a text message, and it is exciting. It's exciting to be part of a survey. I've also been part of the American Community Survey, so it's like fun to see it in action. As far as outreach in terms of like the awareness, other than the Census Bureau's website, I'm not aware of any other outreach strategies. And I know that sometimes when you get, you'll get a text on your phone and you think, well, what is this all about? Is this legitimate? And we certainly get questions like that as data specialists and as do the regional offices. But all I can say is that I just urge folks that are on the call today to help us spread the word about all of the census surveys that are out there. And if anyone ever has any questions about it, they can contact us or they can contact the one of the regional offices and we can help them out and answer any questions they might have.
Awesome. Well, thank you, Kelly. That concludes our Q&A portion.
Great. Thank you. Thank you, everyone, today for attending.
So continuing on what has been discussed, I would like to show you some very important resources before you go, because if you enjoyed today's summit, there's a lot more where that came from. There is so much at your fingertips on census.gov's Census Academy page. There, you can find valuable information on data dissemination and training. There are options to request a free data training for your organization. Again, free of charge. You can also receive our data gems, which are short how-to videos aimed at helping you increase your knowledge of census data. And guess what? We can deliver those to your inbox. So to expand a little more on what I just said, the Census Bureau has a team of specialists like Kelly who can assist in bringing the world of data to you by providing trainings, workshops, and presentations to you and your organization at no cost. The team offers presentations and trainings tailored to your needs, and they can show you a variety of census data tools, data sets, and programs both virtually and in person. Now, let me show you something. We have several data summits that we are presenting between now and the end of August. You can find all information on the 2021 Data Summit page on census.gov. In the search bar at the top, simply type in 2021 Data Summit Series to land at the page seen on this slide. To view all the upcoming summits, please be sure to click Show More. Look to see which ones suit your needs, and you may register. It's a one-stop shop. Upon availability, you can find the recorded versions of the same 2021 Data Summit Series page. Ladies and gentlemen, we want to know your thoughts because there is always room for improvement. So there are two ways for you to tell us what you think about today's session. First, feel free to contact the regional office that handles your state, or as you have been doing over the last couple years, connect with your local partnership specialist for any of your needs and/or thoughts, and they will share it with you. Now allow me to share the information about our regional offices. First, we have the information for our Atlanta and Chicago regional offices. Next, we have the information for our Denver and Los Angeles regional offices. And last but not least, here is the information for New York and Philadelphia. Once again, feel free to contact the regional office that handles your state or connect with your local partnership specialist with your feedback, and they will share with us. Ladies and gentlemen, thank you so very much for joining us for today's Data Summit, Early Childhood, Census Bureau Data Sources. I would like to thank Census leadership, our speakers, Dr. Noreen Dollard, and our key presenter, Kelly Karras. Our objective for this summit, again, was to increase your awareness of the vast data products available through the U.S. Census Bureau to help you be better equipped to utilize some of the free online tools available on census.gov, and for you to have resources and toolkits to assist with navigating data available on our website. Ladies and gentlemen, we encourage you to provide feedback. Again, we encourage you to tell us if you thought something was missing, what you would like to hear more of or less of. We appreciate your feedback so that we can improve future sessions. This concludes today's webinar. As a friendly reminder, please expect a PDF of today's presentation and a resource sheet within 2 business days. This webinar was recorded and will be available at a later date. Thank you for joining us and have a wonderful afternoon.